Parasites are more common than you think. If we haven't met yet, my name is Pam Bartha. I am the author of Become a Wellness Champion and the founder of Live Disease Free. This topic is very near and dear to me because 30 years ago, I was diagnosed with multiple sclerosis. But I have been able to live MS-free for the past 30 years because I learned early on that MS is caused by infections. And we have learned, because I've worked with over 600 people in helping them recover from chronic disease also, that parasites are a huge cause of chronic disease. So with respect to parasites, we're told that we can only get parasites when we travel to other countries. But then in the developed countries, parasites are not an issue. If that is the case, then why is it that we are able to, or we're recommended to treat our dogs, our cats, our horses, our cattle, and other animals at least once a year? And some of you that have animals, you know that you have to treat them more than once a year, treating them for parasites. But so our animals can get parasites, but we can't get parasites in North America. And nothing could be farther from the truth. What is a parasite? A parasite is an organism that lives off of another organism. So it lives off of a host. And so for us, if we have worms inside of us, we would be the host. They would live off of us. They're freeloaders. They eat our nutrition. And it's like we're their house kind of thing. So they require a host to live off of. The different types of parasites, there are some bacteria that can be parasites. So Borrelia, which is the bacteria associated with Lyme disease, that's one type of parasite. There's many different types of other parasites that we would lump as different sizes. So I'll talk about the different sizes. So protozoa are very small, single-celled parasites. So something like Giardia, Blastocystis hominis, amoebas, these tiny little microorganisms that are just like a single cell. They can be round, they can be different shapes, but they're tiny, 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 and that would be protozoa. Those are parasites. Then we can look at other ones that would be more of the helminths. So there could be tapeworms. They can vary from very small tapeworms, like the size of the dot of a pen or smaller, to tapeworms that are over 30 feet long, different types of species. So they're like different types of cousins. There's also these roundworms, which are nematodes, and they vary in length too. You can have these tiny little microscopic microfilarial worms, and you can have bigger worms. And I've shared pictures in some of my other videos of my students passing worms that are anywhere between 6 inches to 2 feet or bigger than 2 feet long. And there's also another type. Let me just finish there. So with the roundworms, we can have whipworms. We can have, they're called ascaris worms. And there's several different types of varieties that we can have. There's also flukes, and flukes are flatworms. So they're kind of like oval shaped, and they are very flat, and they're kind of translucent, and they cause pain in the intestines. They like to live in the liver. They also like to live in the intestines. I should backtrack. With the tapeworms, the large adult forms, they usually live in the intestines, but we're finding that there are some different varieties that like to move into, let's say, the liver. And we know that the immature forms of the tapeworms also like to move into different parts of the body. They can move all the way into the central nervous system and cause lesions and symptoms of multiple sclerosis. And they can move into different areas where we end up with cysts, right? And it's huge. Like this is a big topic. I'm going to be unfolding a lot of this research over the next few weeks so that you can see how pervasive the symptoms and the conditions that they can cause depending on which type of parasite we have and the location. So again, we could have whipworms, we can have hookworms that are those roundworms, we can have those tiny little microfilarial worms that Dr. Alan McDonald found in all the specimens of people that have died of MS in their spinal fluid. He found tons of those little tiny nematode worms. When these small nematodes are present in domestic animals, they have symptoms identical to multiple sclerosis. They get the spasticity, they get the tingling, the numbness, the paralysis, the balance issues, vision, going blind, terrible fatigue, and on and on. The symptoms are so similar to multiple sclerosis. It's freaky. And why have we not made the connection? They've known this for almost 100 years. Veterinarians have known this for almost 100 years. It is crazy. And so we're finding that a lot of the treatments to treat those little worms in animals are really helpful for multiple sclerosis also. So we talked about these small parasites, the single-celled. We talked about different types of worms, whether it's flatworms, whether it's tapeworms, whether it's roundworms. And then we can also talk about fungi. So fungus is another type of parasite. And it's not just Candida, but there are hundreds of species of fungi that can cause disease in humans and are parasites. They live off of us. So things like Candida, but many species of Candida, but then also Aspergillus and different types of molds, etc. So how do these parasites make us sick? Many different ways. The first way would be causing nutritional deficiencies. So things like, there's others, but things like being deficient in vitamin B12 or being deficient in iron, where you have anemia, those would be just two examples of causing deficiencies and causing disease in humans. Then also we know that our immune response to these infections is inflammation. So we can have a lot of inflammation in the body and we can have a lot of immune responses. And sometimes we have immune dysfunction. There's at least 17 different ways that these microbes can cause immune dysfunction in our body. Sometimes it's as simple as making our immune system blind to them. Other times it's like an overreaction. And so that inflammation is another part of how they make us sick. They produce tons of different chemicals. If I just talk about Candida for a few seconds here, we know that there's over 70 different poisons that it will produce. So if we have a minimal amount of parasites inside of us, then we're not really going to have a problem, but it's really the amount that we have inside of us. And so when the populations increase of these various type of parasites, they produce more of these substances, chemicals that affect us in many ways. So things like acetaldehyde, which is a neurotoxin, and things like formaldehyde. And we know that certain worms can produce things like ammonia and amphetamines and morphine-like substances. There are so many symptoms of parasite infections, and it really depends on which types of parasites we have and where they are located in the body and what poisons they produce. So they can affect our cognitive function as far as having terrible brain fog, memory issues, also things like depression and anxiety and terrible fatigue, and also digestive issues, things like gas, bloating, constipation, diarrhea, indigestion, nausea. And then as these parasites are more involved in the central nervous system, we can have a lot of different symptoms like the spasticity, balance issues, tingling, numbness, weakness in our arms or legs, and terrible fatigue. We can also have many symptoms of allergy and asthma and eczema and rashes and insomnia. It goes on and on and on. So the key is, if you're dealing with any of these symptoms, you really need to look into parasites. And if you do have parasites, treat them. It'll make night and day difference with your health. Parasites are always involved in chronic disease. I would like to share 3 successes with you that I just received yesterday. The first student shared, I just finished my first cycle of treating the parasite. So she's using 2 medications, just used them for 2 weeks, and she's recovering from multiple sclerosis. And she shared, I have great energy and sleep is much better since I started these 2 treatments. Again, this is just in 2 weeks. And I've noticed that I think more clearly and I can stay focused longer. The next student shared, I just finished my first round of antiparasitic drugs 2 weeks ago. My energy is pouring back in. I am so thankful. And then another student who is on her 3rd cycle, she shared that I was out dancing last night, and today I'm going on a channel. It's like a canal between 2 lakes, and I'm going floating with my friends. And I'm working out at the gym and I'm getting stronger. So those are the kind of things that we notice. You notice the fatigue lifting when these parasites are being treated. Other things that we've noticed with our students, as they are treating chronic disease, they're treating these infections, we're seeing that people no longer have seizures. We're seeing that their cancer markers improve tremendously. We're seeing that women that, let's say, had multiple sclerosis, we have 2 students that had MS, they were also infertile, and they were able to get pregnant as they treated the infection. So correcting infertility, reversing diabetes, being able to come off diabetes medication. So the exciting thing is that if you're suffering with all these symptoms, you don't have to. You have to treat the cause. And that's what we do in the Live Disease Free Academy. It is a step-by-step plan that you can watch my masterclass training. It's free. If you relate to it, and if you're like, Pam, I want a step-by-step plan. I want to learn how to treat these parasites. I want to get them out of my system, and I want to know how to take care of myself for the rest of my life. That's how I've been able to live MS-free for the past 30 years. If you're at that place, make sure to watch my masterclass training. And please share this video with other people that you know are looking for ways to get rid of those horrible symptoms that they're dealing with. And if you like what I shared, make sure to subscribe to my channel so that I can share more life-changing information with you.